Well, welcome everybody to the third episode of CJDH Between the Lines, a video interview series that supports evidence-informed dental hygiene practice by highlighting recently published research in the journal and exploring the passions of the authors behind those studies. I'm Salmi Levine, scientific editor of the Canadian Journal of Dental Hygiene, and I'm here today with Heather Doucette, a dental hygienist and associate professor in the School of Dental Hygiene at Dalhousie University in Halifax, Nova Scotia. Heather is one of the authors of a timely article on the impact of prebiotics and probiotics on the oral microbiome. Her scoping review analyzes the evidence for their potential use as an adjunctive therapy for treating periodontal disease and identifies gaps in the literature for further exploration. I hope you'll all consider reading the full article later if you haven't already done so. Today, we'll be speaking about Heather's research, the evidence she uncovered, and her recommendations for dental hygienists who are interested in incorporating natural products into their clinical practice. Welcome, Heather.
Thank you, Salme.
It's lovely to have you on the screen.
It's great to be here.
Good. Heather, to get started, can you tell us a little bit about what inspired you to undertake this research on prebiotics and probiotics?
Absolutely. So the Bachelor of Dental Hygiene program at Dalhousie University involves the students conducting a project, a research project. And as part of that, they approach an advisor to sort of supervise their project and to also help them with developing a topic, etc. So students approached me and asked me if I would be their advisor for their project, but to also help them discover or develop a topic as well, because they weren't quite sure of what they wanted to do. And I recently had been very fortunate and privileged to have been taken part in overseeing a clinical trial at the ADA Foresight Institute in Boston. And as part of being there, I got to learn a little bit more about some of the research that was being conducted at the Foresight Institute. And they're very involved in research involving the oral microbiome. And I just found it absolutely fascinating. So I started to sort of explore the literature a little bit more. And as part of that exploration, I realized there was a lot of research being conducted that involved microbiome, probiotics, the oral systemic link, and it just completely fascinated me. So when the students approached me, I started to discuss this with them, and we looked at the research a little bit more and just decided that this would be an absolute perfect project to undertake. And as part of developing that project, one of the things that the students have to do is to land on the best way to develop the project or the methodology that they're going to use. And so we decided to do a scoping review rather than a systematic review, because as you know, systematic reviews are done to discover the literature that is available on a particular topic, but also to critically appraise the literature on the topic. And for this topic, we just felt it was more relevant to discover what was out there, because it is a really new and evolving field. And so the scoping review to identify all the literature that was available on the topic, and then also to identify a gap in the literature to really sort of hammer home what should be done further in this area. So we landed on the scoping review that we had published.
That's awesome. Just fantastic. And it's what a timely topic, especially with the linkages between the oral microbiome and oral systemic linkages, et cetera. Very, very exciting project. So for our viewers who may not know a lot about this important topic, can you tell us the differences between prebiotics and probiotics?
Absolutely. So a probiotic is actually the live bacteria or yeast that's found in foods that we consume. So yogurts, kefir, sauerkraut, some cheeses, or it can be taken in supplement form. And so the whole sort of value in probiotics is that they add to the good bacteria that is present in our whole system. And prebiotics, I guess the easiest way to explain it is that prebiotics are actually the food for the probiotics. So they are the non-digestible fibers that are found in foods that we consume, such as fruits, vegetables, some whole wheat grains. So they actually feed the probiotic or the live bacteria with hopefully the intention of increasing the number of good bacteria that are present in our systems.
That's a great way to describe it. I don't think I'll ever forget that. Food for the for the prebiotics or
That's
for the
it.
probiotics.
That's right.
Okay, so what benefits, if any, do probiotics offer for improving or maintaining periodontal health? What were your findings?
Well, the findings, we're not able to say really definitively the exact impact or to be able to make recommendations from the findings of the scoping review for the use of probiotics as an adjunctive therapy for individuals with periodontal disease, mainly because the studies that we uncovered as part of the scoping review were all very different. There was so many differences with regards to the way the studies were conducted. So the protocol for the study, the methodologies for the studies, and this includes things like the number of participants, the types of probiotics, so the different kinds of bacteria that were included to be examined. One of the main differences as well was the methodology with regards to the way the probiotic was delivered, so the mode of delivery. So there's various ways to deliver a probiotic. One could be a supplement in tablet form, which a lot of people probably already consume, but there's other ways: tablets, lozenges, rinses, sachets, in suspension form. There's just such a variety of ways that it could be delivered. And the studies varied with that delivery method. They also varied with regards to the length of the study. So some studies might have only been a week long, some studies were a couple of months long. And of course, you can well imagine that the differences that could occur in a lengthy period of time would be very different than what could occur in a short period of time on the whole system, whole human system. But also there were differences in with regards to just how many participants were involved with regards to their periodontal status. So the different AAP classifications for periodontal disease, some studies use the old classification system and some use the new classification system. So while the majority of the studies showed that there were benefits to using a probiotic, with regards to different parameters that were used, that were studied. And this is another difference that the studies uncovered, was that some studies would examine, for example, probing depth or CAL or clinical gingival inflammation, those types of parameters, and assess the differences over time with the use of the probiotic. Whereas other studies would look at microbiological factors, so the number of bacteria that were there, and then that were there after the use of the probiotic, and the type of bacteria, or the immunological factors such as the trademarks or the markers for inflammation. So the majority of the studies did show that probiotics decreased the immunological markers as well as the microbiological factors. And then some showed some differences in the clinical parameters, but they were all very, very different. So I think that it's really important that while it is all very, very promising and directional towards the use of probiotics as an adjunctive therapy for periodontal disease, we also have to look at it very critically because of the difference in the studies, and really examine those differences and recognize that what we identified as the gaps is that there needs to be more studies that are conducted that are in alignment with other studies so that we can compare apples to apples. So while it's very promising, we do need to sort of look at the findings very critically as we move forward to be able to recommend the use of probiotics for patients or clients.
That was a great explanation, and thank you for that, because, a lot of people don't understand why it just takes so many studies to actually come up with a real answer. And this is where the systematic reviews come in, because they actually look at numerous different studies and then compare them. And as you mentioned, comparing apples and oranges is usually what they find. And when they don't come to a conclusion, then that's because they haven't had that homogeneous look at, that it has, everything is so heterogeneous. And they do measure that in a systematic review and look at heterogeneity. And that's when they come up with their final scoping or final answer. And so the two studies together, the scoping review and the systematic review, help each other. The scoping review looks at those gaps, and then that spurs on more research. And of course, the systematic review then analyzes the research. So
That's
that's
right. Yeah.
really clarified a lot of things, hopefully for a lot of the participants here.
Yes, and there's so much when the other thing is that doing a scoping review, discovering that gap can sometimes lead to doing the systematic review. So because it gives you that much more information. But when a topic is just evolving, it's really important to sort of gather all of that information. And of course, when a topic is just evolving, there hasn't been a strict protocol that's been established for studies because researchers are just in their own little silo trying to do what they're doing with the knowledge that they have. And because this topic involves so many different factors, like there are the different probiotics, and then there's also the oral microbiome, which is a whole different area. And then there's also sort of the oral systemic link that gets involved as well with the inflammation process, because periodontal disease, as we know, is an inflammatory process. So there's all of these different factors. So it really is a rather large field. So studying it requires a lot of different factors to be taken into account.
Absolutely. It just, I think we could go on for several hours talking about this, but research is very complex. And I think that I like to steer people to systematic reviews, and just simply because at least the studies have been analyzed by experts who do have an understanding of all of those other factors that you've talked about, the heterogeneity, comparing apples with oranges, et cetera, and looking at when can you actually find a real answer to the question. So it is very, very multifactorial in terms of, all of the factors that are involved.
Absolutely.
Okay, and so there's another thing that you mentioned in your article that I'd really like to bring forward and ask you about, and that is that there's a lot of concern in the scientific community recently, and even in the regular community, about antibiotic resistance. And you had mentioned in the article something about a study that compared the use of probiotics with antibiotics. And so is there any hope that maybe we might have a replacement for antibiotics?
Well, I found that really, really quite interesting. That was one for me, one of the very interesting findings of the scoping review, going through the literature. One study in particular by Shaw et al. Examined the use of probiotics compared to the use of antibiotics with individuals with periodontal disease. And so the study, there were three different arms in the study. So one arm was participants who were given a probiotic as a supplement in lozenge form. Another arm of the study, the participants were given the probiotic and doxycycline, the antibiotic. And then the third arm, the participants were only given the antibiotic. And what they found was that the results were all similar. So the periodontal parameters that were measured, so periodontal depth, cal, gingival index, those all decreased similarity across the three groups of participants, as did the microbiological and immunological markers. So I thought that that was absolutely amazing. But again, as we go back to studies and how studies are conducted and critically analyzing the evidence, it is extremely promising, and it would be amazing if, in fact, probiotics could take the place or complement antibiotic use for periodontal patients in the instances where they're required. But we do have to sort of take this by realizing that it was just one study. So again, more studies need to be conducted to confirm if perhaps antibiotics could be used as an adjunctive, or if probiotics could be used in place of antibiotics or along with antibiotics for the treatment of certain types of periodontal disease and certain conditions.
That is such exciting results. It
Really
just
is.
My mind is just going 100 miles an hour thinking about all of the benefits of that. However, as you mentioned, that was only one study, and we have to always remember that one study does not interpret to generalizing the results to all studies. So everybody is different as well, and I think we have to remember that the oral microbiome is very different for all of us. And so the probiotics, I'm sure, also come into play there. And again, I think it's going to be quite a complex undertaking to start to gather all of those studies and get enough studies together to actually come up with a specific answer. But what exciting news. It really is. And
Very
it's a
exciting.
very wide open area of research. So I'm so pleased that you've been able to come and talk about this. But it certainly is very exciting. And hopefully our audience has found that very exciting as well. And so basically to wrap this all up, um, what would be your take-home message? What should dental hygienists be telling their patients about probiotics?
So the take-home message, I would think, would be that there's a lot of research presently being conducted on the use of probiotics and their potential implications and potential use as an adjunctive therapy for the treatment of periodontal disease. What I would caution dental hygienists or oral health professionals in doing is that when we look at, as we've mentioned, when we look at studies to make recommendations, we do have to be aware that we need to be able to critically analyze the literature that is available when we're making any kind of recommendation. And part of that is knowing how to do that, which is difficult. So being able to understand if a study has been conducted in a way that allows you to make a recommendation from that study or from a number of studies. So with regards to the use of probiotics with periodontal disease, while it's all very promising, it also has to be backed by probably some more science. And I think that we all know that periodontal disease is an inflammatory disease. So if you think of probiotics and the role that they play in inflammation just systemically, then it makes sense that if probiotics are able to decrease inflammation systemically for individuals, then that may also help to decrease the inflammation that is responsible for either the initiation or progression of periodontal disease. So perhaps the use of probiotics could help decrease the inflammation to decrease the extent of the periodontal disease or the initiation of it. But the other role that probiotics can play is they not only play that role in inflammation, but they also play a role in increasing the good bacteria in the oral microbiome. So it's like they have sort of two roles to play that could be beneficial for periodontal disease, because there's about 700 bacteria that are present in the oral microbiome. Not all of them are bad, not all of them are good, but it's coming up with that balance, because periodontal disease is also initiated by the dysbiosis of the bacteria. So the bad bacteria overgrowing the good bacteria. So I usually explain it in the same with the analogy of using a lawn as an explanation. When you want a good lawn, you try to pull all the weeds out, which would be the bad bacteria, and the grass is the good bacteria. So you try to pull all the weeds out and then hope that the grass, until eventually the grass takes over and you have more of the good, the good grass as opposed to the weeds. And dysbiosis is the same thing. So with probiotics, it adds to the good bacteria, so they outnumber the bad bacteria, which improves the oral microbiome and makes it conducive to not initiating the progression of periodontal disease. So I think that dental hygienists can continue to look at the literature that exists and where this is going before they're making recommendations, but also to realize that when making recommendations, it's very important to individualize it to the patient, because patients are all present very different with very different systemic issues, etc. And making recommendations needs to be based on that individual patient, in consultation with their primary care provider or doctor as well, because there's a lot of misinformation on social media, such as TikTok, where patients and clients are coming to us with things they've seen and heard on TikTok and expecting us to be able to give those recommendations. So the onus really is on us as primary healthcare providers to keep up on the evidence and on the literature to be able to make reliable, good recommendations that are grounded in science to our patients.
Absolutely. That's fantastic explanation. And I want to thank you so much, Heather, for giving us such an interesting insight into your research and the world of oral probiotics. It's clear that they have the potential to improve periodontal health and perhaps even overall health with very few risks. So hopefully your scoping review will inspire others to take up the research necessary to support the use of probiotics as an adjunctive therapy in dental hygiene practice, and also search that literature and make sure that that they're familiar with what's coming out, because I think there are so many new studies out there. And as you mentioned, Heather, looking at a whole group of results like systematic reviews, and also taking into consideration patient variability in order to arrive at that symbiotic state. And so recommending also that they see their physicians. So very, very exciting, very exciting. So thank you again. And I encourage all of our viewers to set some time aside to read Heather's article in full. If you're a member of the Canadian Dental Hygienists Association and accessed this video from the cdha.ca website, you'll find the article in the curriculum, along with a set of self-reflection questions that will allow you to obtain a certificate of completion to use towards your quality assurance requirements. If you're not a member of the CDHA, you can retrieve the article from the journal's website. Just go to www.cjdh.ca and look for the October 2024 issue in which Heather's article appears. So thank you very much for watching.
Thank you.